Hi, I'm Peter Notarstefano. I'm Director of Home and Community-Based Services at ASA. Today we're going to talk about, with healthcare reform in a holding pattern, where are we right now? Well, first what we have to do is we have to make sure that the provisions in the healthcare reform bill that were positive for home and community-based services, that they continue, that they actually become law. And I'm going to go over some of these provisions that are important for all home and community-based service providers. First, there was a hospice concurrent care demonstration in the bill, that's still in the bill, that would have connected hospice providers and home health providers. That would have been a tremendous demonstration that would have helped the expansion of post-acute services, and it would have helped our members, both hospice members and home health members. The Independence at Home demonstration, there is an Independence at Home bill that Senator Wyden had introduced, and it was in the bill. And that would have given incentives to physicians to provide nutritional care, provide nursing care, referrals to long-term services and supports to improve outcomes and reduce readmissions to hospitals. The Community First Choice option, which would have increased funding for personal care services for the states. The extension of the Money Follows the Person grants, that would have been important for home and community-based service providers. The expansion of Aging and Disability Resource Centers, which is the single point of entry, which would have helped with information and referrals for caregivers and patients to find home and community-based services in their communities. Additional funding for the National Family Caregiver Program, that's through the Older Americans Act, is in the bill, and we want to make sure that that ends up in future legislation. Spousal Medicaid eligibility, which would make home and community-based service spousal eligibility the same as nursing home spousal eligibility. The integrated care, the transitional care demonstration projects would have helped our home health members, our adult day members, PACE program members. The 8-state adult day amendment that's in the House bill. There are 8 states that CMS has been trying to shift the adult day health programs from the state Medicaid program into waivers. If that happens, a number of individuals who are using adult day health programs right now will lose services, and we want to make sure that that doesn't happen. We also want the 3% additional funding for rural home health agencies, and that was also is in the healthcare reform bill. Now, since we don't have a healthcare reform bill, what happens with home health cuts? We have to look at what's the next step. What's basically going to happen is that the home health agencies will the payment will refer back to the rule that went into place in July of last year. And what the rule said is that there would be a 2.75% reduction in the home health prospective payment rate, which is basically the case mix creep adjustment that CMS made. There would be a 2% home health market basket increase, which is good news. And there would also be caps with the outlier payments of 10% of the total home health prospective payment. CMS will also require the submission of OASIS data, which that was also a MedPAC recommendation. Now with hospice, we would have the same situation. It would refer back to the rule. And what the rule says is that there would be a 1.4% increase in the hospice Medicare reimbursement for the year 2010, and a 2.1% increase in the market basket. So that's good news. And the other good news that we have to report is that the rule would phase out the budget neutrality adjustment factor, that wage index phase out that CMS is insisting on, over a 7-year period instead of 2 years. So basically the cut is over a 7-year period. It's less of a negative impact on hospice providers. On February 1st, the President will submit a budget, and we don't expect the budget to have good news, to be honest. We want to make sure that the President's budget and that the Congress passes a budget that does not cut social service block grants, the Title III B and E, that's the supportive services and National Family Caregiver Program, as well as meal programs. We want to make sure that we protect the funding for all of those appropriations within the Older Americans Act. And we'll know more on February 1st, and we'll have a blurb on the budget sent out to all members at that time. We want you to look at some legislation, and it'll be posted on CapWiz on the ASA website, concerning legislation that promotes home and community-based services. First is the Medicare Adult Day Services Act. It was introduced by Representative Linda Sanchez at the end of June last year, and it would allow adult day health programs to provide post-acute services under Medicare. Also, a home health agency could contract with an adult day program if this bill passes. We have the House bill, we have 53 co-sponsors, and hopefully soon we will have the bill introduced in the Senate, and we could use your help with grassroots advocacy on that bill. Also, there's the Empowered at Home Act. It's Senator Kerry's bill. It would improve eligibility for home and community-based services, and we also have a letter on Contact Congress for that. There's the Community Choice Act, which would improve Medicaid funding for states to promote personal care services under the state plan. There's the Class Act, which sets up the National Insurance Trust Fund. And last, there's the Independence at Home Act, which sets up, again, the House Call program, which gives physicians incentives, which hopefully will increase referrals to home and community-based services and really break down the silos between different provider types, between physicians, long-term services and support providers, hospitals, and nursing homes. Please read all the blurbs in the Home and Community-Based Services report, and feel free to drop us a note concerning any information that you would like, any additional information. And also on the ASA website, there are listservs for home and community-based services. There's the Home and Community-Based Service listserv, the Home Health listserv, Adult Day listserv, as well as the Meal Provider listserv. And we would love for you to join and post your comments and participate with our members on being part of the process. Thank you.